says it's live on Facebook.
Are we live?
That's what my little icon says.
I think we're good.
All right. Is it rolling? Awesome.
Yes, we're good.
Oh, okay. All right. So I closed out the Facebook. I have no idea how many people are on or not, but let's get started. Welcome everybody, those of you who joined us, welcome to Salaam Clinic Live. It's a webinar series to educate the local community.
Excuse me, is it starting?
It's a local, it's our first time doing this. All right, everybody, welcome to Salaam Clinic Live. It's a webinar series to educate the local community with up-to-date and evidence-based health information regarding current topics. For those who don't know, Salaam Clinic, we are a free clinic that has free primary and preventative care for the underserved population of Northeast Ohio. That includes children, both uninsured and underinsured. We began operations back in September, and we're really thankful that we've been able to impact a lot of lives through our healthcare that we offer for the underserved population. When COVID happened, we had to actually shut down our clinic, so what we had to do was set up telehealth services. We had to do it very quickly to keep continued care for our patients so that they didn't have any gaps in their care. And it's great to see the work that the volunteer physicians are doing at Salaam Clinic and the way it's helping patients. We've had patients who literally haven't seen a doctor in years, and we've seen patients whose lives have been saved thanks to the physicians at Salaam Clinic coming in to volunteer. So we cannot be more grateful for them. This webinar will be the first out of many surrounding the current hot topic, which of course is the COVID-19 pandemic. And in specific, we have a pediatrician with us, and her name is Dr. Simee Malik. Dr. Malik is a graduate of the Medical College of Virginia and completed her training in pediatrics at the Metro Health Hospital. Dr. Malik is a staff pediatrician at Lake Health for the last 20 years and is an adjunct professor at Case Western Medical School. Dr. Malik is also the director of pediatrics at the Salaam Clinic. Dr. Malik has been an enormous asset to the community through her outreach efforts, her interfaith efforts, and other charitable efforts through various organizations and nonprofit organizations, such as the Chagrin Valley Islamic Center, the Pakistani American League. She is also the vice president of Child Life Foundation, the Cleveland chapter, and the liaison for the Cleveland chapter of the Islamic Medical Association of North America. Dr. Malik co-founded the Our Sisters Keepers organization, which is a women's organization for interfaith dialogue. So Dr. Malik, how are you doing?
Good, Alhamdulillah. Thank you so much for having me.
Oh, no problem. Keeping safe and family's doing well?
Alhamdulillah, everybody's doing well.
Good. So, just before we kind of get into the whole COVID pandemic and pediatrics, can you give us just a quick background about the work you do in pediatrics?
Sure. So I'm a general pediatrician. So most of my day is spent doing checkups and sick visits on children, basically newborn until almost officially 18, but I have some, college students that don't quite want to leave yet. So I do have a couple of like 19, 20-year-olds too, but officially till 18. And yeah, a majority of my day is spent doing regular checkups and then sick visits. And I also do ADD consults and, anything that your child may need as far as checkups go.
Oh, okay, nice. And how has the COVID pandemic kind of impacted care in pediatrics?
So it's really made a huge impact because we don't want people out and about during this pandemic. And so coming in for routine care we basically were encouraging children 2 and up to kind of defer care for a few months, especially March and April. We continued to see children under the age of 2 because of vaccines. But it was a logistical, like there's a lot of logistics involved because we were only seeing healthy kids. And then we switched to doing televisits or telemedicine for our sick visits, for the most part, whatever we can do. I mean, obviously you can't listen to heart and lungs through your laptop, but we did as much as we can. I've gotten really good at doing rashes and those kinds of things, and like a lot of medication follow-ups versus on telemedicine.
And obviously immunizations through a computer.
No, can't do that either. So, and then, so much of pediatrics is growth and development. And so some things we can see, but most of the checkups we were doing in person, but we had our schedule sets that we never had sick patients in at the same time as well patients. And then, we just made sure that there was nobody in the waiting room. Sometimes we were calling people down, they checked in from their car and then we would have them come up. Just a lot of like precautions like that. Cleaning we've always done, but it's just very stringent cleaning now.
Yeah, definitely. And you mentioned March and April. Is that still the case now?
No, so we are doing regular checkups because, and if you have children, this is big time sports season. We do all the sports physicals, we do daycare forums. I mean, those things happen all year round, but definitely all those athletes want to get their sports physicals in. So we are seeing pretty much, I'm almost up to normal volume at this point. But there are certain things we're not bringing into the office. We are kind of deferring to the local fever clinics and urgent cares and things like that. So.
Okay, great. Okay, so let's kind of get into the whole COVID-19 pandemic and children especially. I know the big question is on everybody's mind is it safe for children to go to school?
So that's a very loaded question, as you know. There's one thing you basically have to kind of think of. Each child and each family's needs are different. Okay, so you have to look at your own school district and what they're doing and what your child's needs are. So, there's some children that have to go to school. They have parents that are essential workers, or they have special needs and they don't get those services at home, or they can't really learn via computer. So in that case, if you fall into that group, it's really, really important that you could do in-person learning. But there's a whole, group of people that might do perfectly fine doing online learning or distance learning, as it's being called now. So, it's really, really family dependent. You have to look at what the benefit for your family is.
Mm-hmm. So we spoke about really quickly, it depends on family to family. Is there a situation in which the family should say, hey, let me think about it again if my kids should go to school? And what would that?
Yeah, so anytime you have anybody at home that's got health issues, it's definitely everything is different, a different process, right? I mean, going on vacation to Disney World is a different thought process when you've got a kid that's got asthma or elderly person who's at home with you. So you really have to look, and then honestly, who's going to be able to do that distance learning with your child too? I mean, it's really hard for working parents who are working from home to also be full-time teachers. That's why we have teachers. So there's a lot of balancing that needs to happen. And I think each family knows their own support system and their own resources that they can use. But one thing that's really hard that a lot of people don't realize is that some children get 2 meals a day at school. Not everybody is in the same situation. And, school provides a lot of other things besides just education. And some of that can't be done virtually, and we have to kind of look at all that. You personally have to look to see what your school district is providing and what your own personal needs are.
Mm-hmm. So given the current situation, and that each family should kind of judge their situation appropriately, how would parents know if their kids are in contact with people who might have COVID at school, or if they themselves are infected?
So Cleveland is kind of an interesting place to be because we don't have enough testing. So you have to meet certain criteria in order to be tested. Okay. But having said that, also there are certain things that in general, you should stay home for, right? So, I mean, your kid being fever free for 24 hours before they go back to daycare or go back to school has been a standard everywhere, right? Now the only difference is it's not 24 hours, it's 72 hours. Your child must be fever free for 72 hours before they go back to school or daycare. So I think there's a lot to be said about common sense also. I mean, you shouldn't, especially in a pandemic, but you should honestly never send your child. They feel like they've got a fever, you don't give them a dose of Tylenol and send them off to school. That's never good, but it's really, really bad during a pandemic. So,
if they have fever, then so it takes 3 days now. After the fever is gone, 3 days, and then
yes. Yeah, that's like the new guidelines that's happening because of COVID. So,
okay.
yeah, I mean, it's most daycares are, or daycares or schools once you're fever free for 24 hours, and that's without medication.
Yeah.
So, fever free without medication for 24 hours, it used to be you could go back. Now they're kind of saying 72 hours is safer with the new coronavirus.
Are there any other sort of current guidelines you could share with us?
So, well, before we get into the guidelines, I really kind of wanted to talk about prevention, if that's okay, because
Perfect. Yeah.
So, because there's certain things we can all do. Okay, hand washing. I know it sounds kind of silly, but hand washing is really important. And if you look back, most people were probably not washing their hands for long enough. I mean, singing "Happy Birthday" twice, making that a rule at with your children, and teaching them to wash their hands that way, and make sure they like go between their fingers and get into their fingernails. I mean, there's a way that you can teach children and adults to wash their hands properly. And I know it sounds really silly, but it's really, really important. Not touching your face. I'm really guilty of this one. I am constantly like scratching my eyebrow or and I've had to really watch myself. So kind of prompting your children also not to touch their face frequently is really, really important. And then of course, wearing a mask. I know that's difficult for a lot of people to comprehend, but you do get used to it. It's not comfortable, but you're doing it for the greater good. And children I'm amazed. I've seen like little toddlers wearing those adorable little masks, and they keep it on, and I'll say, pull it down, I have to look in your mouth. And then they'll immediately put it back up. And it's amazing to me, but it's all about like, the more you expose them to it, the more comfortable they get. Now, most school systems, from what I understand, are saying 10 and under don't need to wear a mask. And it is very different wearing a mask for like an outing versus, all day long in school. But it is something that you should definitely, if you're out and about with your children, if you're going to the grocery store, if even at the park where there might be other children around, get them in the habit of wearing a mask and definitely washing their hands and using hand sanitizer.
So there's a lot of worry sometimes coming from the community regarding masks and regarding being able to breathe. Maybe their child's an asthmatic or something like that. What would you say to parents who may have that hesitation?
So there is no medical condition that precludes you from wearing a mask, okay? It's not going to make your asthma worse. The only caveat to that would be kids with certain learning issues, like an autistic child might have a harder time wearing a mask, okay? So in that case, there's certain behavioral developmental things that it could be an issue for. But an asthmatic can do perfectly fine with a mask. It's not comfortable, but it is something that you can get used to. I mean, I did not used to wear a mask all day long when I was seeing patients, but I do now. I wear a mask and goggles all day long. And, I'm a constant water drinker. I'm constantly drinking water, and I have to remember to take it off a certain way to grab my sip of water, or, it's you accommodate, I think. And yeah, as in asthmatics, I mean, that would be under that special, special kind of child. Do I send them back to school or do I not send them back to school? Not because of the mask, but because of whether or not they're on inhaled steroids. So children that are on inhaled steroids, that's more considered like a chronic kind of asthma thing. And that family should think about it a little bit more and weigh their options.
All right. Nice, thank you. So we actually have a question coming in from Mebish Bukhari. She asks, what are some of the things parents can do to encourage good mental health during this pandemic?
That's a great question. And I think it's really, really important for children to get outside, okay? Playing outside is so important. Just the fresh air. I think adults need it also. Whether even if you sit outside for a little while, go for bike rides, go for walks as a family, go for runs. I think honestly, depending on the age of your child, making sure they connect with their friends in whatever way they can. So, little kids can FaceTime their buddies. They can do like little Google chats. It's really kind of cute. It's really important for them to connect also. I know, like, if you're like a lot of kids are video gaming with their friends. Some of the older kids watch movies together. There are all these great resources via Zoom and Skype and all these different things that we now have that you can still connect, because we all need human interaction, and children do as well. Younger children definitely need to run around a lot more too, although I recommend that for older kids also, because I think it's really important to get outside. None of us should be sitting in front of our computers or TVs or video games. We should all get outside. It's really, really important for our mental health, so as well as physical health.
Mhm. All right, good. That's great. Thank you. Now, when it comes to certain aspects of mental health and this pandemic and all that, I know our schedules got really upset when we had to kind of come inside. Is how important is a schedule in that sort of?
Yeah. So I think it's very important. Now, this is also kind of family dependent also. Okay. It's I think structure in general is really good for kids. They do better with it. That's why they do better in school. So just kind of playing every day differently for most children won't work well. It doesn't mean that you have to get up at like 7 o'clock every morning. But especially if you're home with your kids, have some kind of structure to their day. Have breakfast around the same time. Do one activity and then get out and get outside for a little while. Have certain things that you do, but a structure is really good. Just they know what to expect. It makes the uncertainty a little bit less, which helps with anxiety. The incidence of anxiety has gone up a lot during this whole thing, and it's adults as well as children. And children show anxiety in different ways. A very classic thing for kids under the age of 10 is my belly hurts. A lot of like complaining about their belly hurting. Kids over 10, a lot of times it's things like headaches. My head hurts. So they can manifest their anxiety in different ways. Not to say that you shouldn't get their belly and their head checked out, but I'm just saying that it can also be like anxiety can mimic those kinds of things too. So a schedule will definitely make everybody's life a little bit easier, the parents as well as the children.
So for a parent whose child might be a little bit on the anxious side, what are some other coping sort of mechanisms they could use?
Yeah. So there's definitely really good resources. So the wonderful thing that's happened with this whole thing is like psychiatric care and counseling has done in general really well with the virtual visits. Okay. So there's certain techniques you can teach, and it's really kind of age dependent, but getting them to like breathe like slowly, just deep breathing. I know it sounds funny, especially if you've never done it, but you breathe with your child and it really helps. And the weird thing is you can't say calm down or relax, because obviously if they could calm down or relax, they would be doing it. So you have to like really refrain from using those particular terms and just say, hey, breathe with me, and just kind of get them to slow themselves down a little bit. Distraction also works really well. So if your child is getting anxious about, school or something, just kind of taking their mind off of, just kind of redirecting them. And then, when they're a little bit more, relaxed about it, sorry to use that word, but when they're a little bit more relaxed about it, you can kind of come back to what was making them anxious. Yeah.
Okay, thank you. Thank you so much. And we are open to all questions. So if anybody has a question, please feel free to let us know. So, I think it's a general understanding that kids aren't affected as much as COVID. Is that true or false as adults?
So yes and no. Okay. So kids definitely do get COVID-19. Okay. They're just not necessarily as sick with it. Okay. But the problem with that is that a lot of times they have, they have the typical little kid symptoms. They have like a fever and a little bit of a cough and a runny nose and maybe some diarrhea or vomiting. But kids get that a lot. I mean, in general, right? They're getting it a little bit less right now because they're not meeting with their friends as much. So those kind of illnesses have gone down, but kids are not necessarily ending up in the hospital on ventilators and things like the way the adults are. I mean, there are a few. I'm not saying it's not happening, but it's a little bit less with the children. But what happens is when kids feel fine, and sometimes even when they don't feel fine, they still want to do all their normal things. So they want to go out, they want to see their friends, they want to see their grandparents. And so what's happening is becoming a public health crisis because they're seeing other people who may be getting sicker with this illness. And that's why it's really, really important that if you suspect that your child is sick at all, keep them home, stay home for, either 14 days or 3 days, 72 hours past the fever, whichever is longer. Fever is actually the one main thing that that kids, will have when they have it. So the other symptoms are a little bit different from adults.
And so when fever, you're talking about what's the threshold for a fever, for a temperature?
So normally we say 100.5. So anything consistently over 100.5, I would start monitoring. Yeah.
Okay. So if somebody has a thermometer and they give it to their child to check their temperature, it says 101 degrees.
Yeah.
Follow
So
that.
101 degrees, I wouldn't rush into the ER or anything like that. Okay. It really depends on how your kid does. I mean, you can definitely give Tylenol or Motrin, preferably Tylenol during this crisis. And then just kind of hydrate, right? The things you would do for like a normal cold or a flu, you make sure that they're hydrated. If anything changes, if they have any other symptoms, then we need to see them, okay? And contact your pediatrician. Let them know what's going on. We're available. This is what we do. So they might not necessarily, like I've had a lot of calls where, we've suspected a COVID, but we haven't necessarily done anything about it besides just kind of staying home, doing supportive care. As long as they're not having any kind of breathing difficulty or they're not dehydrated, most kids will be able to do okay with this.
Oh, nice. All right. So another question came in from Mecca East, who's actually really involved with the Salaam Clinic as well, our chief operating officer. But she's been reading that the blue light coming from our electronic devices can affect our sleep patterns, which is why we now have the dark screen option now. Can you explain the importance of keeping our melatonin levels balanced, especially with technology usage?
Yeah, that's a great question. So I pretty much ask kids where they charge their phones. So, and it's amazing to me how much younger and younger the children that have phones or iPods or tablets are getting. But I always ask them where they're charging it. Ideally, it should be in a central area. It should not be definitely not next to their head in their room, okay? Or across the room, because it does mess with our sleep cycles. The lights from the electronics. I mean, it's so funny because it's a little bit different with younger children than it is with older children. Older children, it's also because even if they put on do not disturb, they know their friend is snapping them or TikToking or whatever, and so they're really interested in it, right? So they can't get into that deep sleep. With younger children, it's just specifically the light that can be a problem. And honestly, this is the same for adults. The adults that fall asleep in front of a TV, which I know is a habit that a lot of adults have. It's a horrible habit. You do not sleep well at all. And I have kids that do the same thing. And when I find out, I'm like, get that TV out of your child's room. It doesn't need to be there. So
I should go move my charger from my bedside table?
Yes, you should. You should put it like across the room. Absolutely. Or in a central area. So.
All right, cool. So say that a child has a fever, potentially has COVID, can they give it to their parents?
Yes, they can. Absolutely, they can.
What are ways that they can kind of mitigate that sort of spread to it? Or should they be mitigating it?
Yeah, sorry.
Or I guess the question, how should a parent react if their child has these symptoms?
You know what? I've had a little tiny bit of an emergency at home. Do you mind? I'll be right back. I'm so sorry to do this.
Oh, no, that's all right. That's all right. Please, no.
Sorry.
No, it's the evening time right now.
I'm a mom too. Sorry.
Okay, all right, let's see. So family emergency on the webinar, and that's kind of how these things go. I know with us on here is Azam Kazmi. He is a director from Salaam Cleveland. Maybe he could fill the gap right now and help us out by telling us a little bit about Salaam Cleveland and what we do as a nonprofit in Northeast Ohio, what our programs are, and where we're headed with the organization.
Yeah. Thanks, Shoaib. Appreciate you bringing me in this meeting. Yes, I'm one of the board members and volunteer of Salaam Cleveland. Salaam Cleveland was founded in 2002 by Zarina Siddiqui and Zahid Siddiqui. And it's been an operation for a very long time. It's a women's organization that helps the community in need. We've been involved in a lot of different programs. I think a lot of people in the Cleveland community know about it pretty well. We have a lot of programs. One of the big popular programs with kids was the Salaam Kids program that did a lot of events in the summer. Obviously, with the shutdown, that caused a lot of those activities to slow down. But we plan to pick them up once things are back to normal. So, we are constantly looking for volunteers and people that can contribute in providing social services to the community.
All right, thank you so much. I think we have Dr.
Yeah.
Malik.
Sorry about that. I'm so sorry.
No problem. All right, so kind of just picking up where we left off. How should parents react if they feel that their child has COVID in terms of protecting themselves, protecting maybe a grandparent or something of that sort?
Right. So, okay, the people that are in the household with the child, I mean, they most likely have been exposed also. So definitely taking your temperature every day, just kind of monitoring a cough. Children are usually getting like a productive cough with it, whereas adults are getting more of a dry cough with it. I would say if your grandparent is not living with you, if you don't have an elderly person living with you, then don't visit them, don't see them. If their daycare provider is somebody with health problems. I actually know of a mom, one of my patients' mothers who actually got COVID, and her toddler actually went to go live with somebody else while she was recovering. Obviously you can't do that to your own child, but I would get whoever does not need to be in that household out. And just monitor your temperature, see how you yourself are feeling, hydrate. Definitely hydration is very, very important. And talk to your physician as well as your pediatrician.
Okay, great. Thanks.
And hand washing, sorry. I got to put a plug in for hand washing. Hand washing, yes, definitely.
How long should children be washing their hands?
Same as all of us, 20 seconds. Happy birthday twice, okay? Happy birthday twice. I actually sing happy birthday to coronavirus, which I don't know why I do that, but I keep forgetting whose birthday it is. So I just as I'm washing my hands, I'm singing happy birthday to coronavirus. So I have to come up with somebody else.
That's a good way to do it.
So,
make every hand washing feel like a celebration.
Exactly.
All right, let's see. Next question we have. What should parents be doing for their kids in terms of routine care or ongoing sort of pediatric care?
So, children should be seen after the age of 3. Children should be seen yearly for a checkup. Okay. Under the age of 3, it's a little bit more frequent than that. But a lot of people, you get your kindergarten shots, and then it's so sad that I don't see them again until their 7th grade shots. And I'm like, where have you been for the past, 5-6 years? Really, children should be seen every year. We monitor their growth. We monitor their development. We keep track on if their puberty is going normally. So there's a lot of things that actually do happen at those checkups, as well as talking about things like wearing your bike helmet, wearing a seatbelt, sitting in a car seat. Some things that, parents do tell their children, but sometimes when you have a voice of authority doing it, they might listen a little bit more. I sometimes give the vegetable homework to children, and that entails if you don't eat a vegetable, when you come in for next year's checkup, you have to tell me 2 new vegetables that you're eating, and just, dietary things like that. So seeing a pediatrician for checkups is pretty important every year.
Oh, wow. Nice. All right. So I think that's a lot of good information in terms of, I know you mentioned earlier that children, some children should go to school because they get the 2 meals a day.
Right.
Um, and now vegetables and all that. So how does diet kind of play into COVID-19 with children, especially the children who might not be able to have access to a healthy sort of diet?
Yeah, and that's what you would think, being in a developed country, we wouldn't have food deserts, and we absolutely have food deserts. There are places in Cleveland actually that are lacking, some of the fresh produce that we need. It's really easy for me to say, hey, everybody should be getting like fruits and vegetables, but sometimes, that's not as easily done as it is that it's said. So there are, I mean, in some of those areas where you don't have the fresh produce, there are like canned green beans, canned peas, those kinds of things that you could do. They're not the best. They don't, they definitely can leave a little bit of, taste is not that great sometimes, but freezer vegetables are not that bad. But yeah, you just have to make sure that you're eating healthy. Children, everybody should be eating breakfast, and your breakfast should not just be a bowl of, Cocoa Puffs. It should be, a cereal with the fiber, maybe even like a piece of toast, and protein is necessary too. So, get scrambled eggs. So eating a healthy, well-balanced diet is just in general good for your immune system, as well as getting outside, getting vitamin D, those kinds of things, just staying active. Um,
So,
yeah.
so can I eat a bowl of Cocoa Puffs once in a while? Is that okay?
Once in a while, it's okay. Once in a while.
I
I
could
just
get
want to make it a daily habit.
the
So,
Reese's Puffs too.
yeah. So,
Another question coming in. Do you think it's safe to travel yet for
so it
children?
depends on where you want to go. Okay. First of all, it depends on where you want to go and what you want to do. Okay. So if you are going to visit a family member that has also been kind of staying at home and, being careful and socially isolating, that might be okay. If you want to go to the beach in Florida or go to Disney World, I would probably say, no, don't do that. Not a good idea. Okay. So there are it definitely depends as to where you want to travel. I mean, it's kind of interesting that, the Americans aren't allowed to travel out of the country anymore. So that's kind of interesting right now. But yeah, so it really depends on where you want to go. I know families that are taking vacations and they're just going to like a cabin by a lake where they're not going to be around other people. And that's probably okay to do. But I wouldn't go to places like amusement parks or any place where there's going to be a lot of people. I would avoid those kind of places.
Mm-hmm. And does a mode of transportation, like maybe airplane versus a car, or?
Yeah, I mean, airplane travel is a little bit riskier, right? I mean, you're just getting exposed to so much more at that point. And kids will, if your child can touch it, they will touch it. I mean, that's just, parents know this. You can only do so much, but that's where you're going to be traveling with hand sanitizer and like Lysol wipes and those kinds of things. Just if you can't get to a sink to wash their hands, definitely clean them off as much as you can. Encourage them to wear masks depending on their age. Just when they're around a lot of people, if you have to travel like by plane or train or anything like that. Safest mode would be your own personal car.
Yeah.
So.
All right.
Or
Well,
bike.
it's always good to know, because I know a lot of times it comes up, hey, maybe a relative is sick or something. Can my kids hop on this plane with me to go visit them? Like,
Yeah.
what would sort of your answer be to that individual who's in that sort of position?
Well, I definitely, right now, you shouldn't be going to visit sick relatives anyways, right? You're not going to be allowed to see them in general, like especially if they're in the hospital, you're not going to be allowed to see them. But yeah, no, I mean, it's kids in general have, I almost want to say they're germier than adults in the sense that they're touching everything and they're putting everything in their mouth. Not that they're innately dirty, they're exposed to more things in general, right? And so in general, we tell people not to bring their runny nosed child along to the nursing home or something like that. So just use common sense when it comes to those kinds of things. If you've got a parent that's a diabetic or is or has kidney issues or has asthma, anything like that, you're slightly sick child could make them very sick. So just, use common sense when it comes to things like that. I mean, this is not the time to be going to visit people. I mean, it's unfortunate, but we are having a worldwide pandemic. So I think, save it for next year. So if you can.
Okay.
And Zoom, catch up with you. We've been so good in our own family about Zooming with family members all over the world. We started it during the quarantine, but it's like, it's really nice. I mean, talk to my brother-in-law in Australia every week, and my brother-in-law from Pakistan calls in, and it's really kind of neat. This is something I think we're going to continue afterwards too. So
that's pretty cool. Yeah, I know my family, we do the WhatsApp stuff all the time.
Yeah.
So in terms of so the children that are with their parents inside their house, and they're kind of doing well, they're kind of hanging out. Now their child wants to see their friend. The advice is kind of, hey, try to get together via Zoom, or would it be like, what would be your advice if a parent wants a child to maybe go bike riding with a friend?
So outdoors is safer. So bike riding in general is great. Going for a walk, depending on how close they are to each other. But it's almost like, I think if you as a family have your circle and it's a small circle, and then your friend has a small circle as well, those two circles could probably meet, but just make sure that they are not meeting with a bunch of other small circles too. So if you get what I'm saying. So it's like, if you keep your circles small and contained, you like, my youngest daughter has a friend who, it's her best friend. She lives down the road, and she was planning on seeing her for 4th of July. Well, her friend went to go play volleyball. Okay. And so my daughter got really upset and said, I was going to come see you, and now I'm not going to see you because my 85-year-old grandmother lives with me, and I'm not going to come visit you anymore. And they were going to be in the yard, like with masks on, just talking to each other. But she was old enough to kind of make that decision that that's not a good idea. So if her friend had, she has one other friend who basically, they don't leave home either. So we do get together in yards, and they talk to each other and they hang out because, and tomorrow they've got like a plan to go out to the park together, and they're going to be socially distanced from each other, but they found ways to communicate. But I know that family isn't going anywhere either. So it makes it a little bit easier. So it's not quite as bad as it was in March, where we just kind of buckle down, don't go anywhere. I think you can, if you trust the other family and you know what they're doing, then you can, your two small circles can meet.
Okay. I mean, that's good to know. So it's not so much, hey, you're stuck in a room by yourself, and it's also not, hey, walk around an amusement park, but it's somewhere
in between. Yeah. And it is very family dependent too. And just, it's in our family, there's one particular member of our family who is very, very social, and we have to stop him constantly. You don't go there, just come back. So there are people that it's hard. We can't all just sit in our rooms by ourselves. It's not good for our mental health either. Yeah. So, I get creative. I mean, my daughter who drives, her and her friends have all met in a parking lot, and they've all sat in their, like in their trunks, talking to each other and I'm like, okay, that's kind of creative. They meet in a parking lot, and they make sure that they're spaced out, and that's how they communicate, and they get together and see their friends, and they all got their own like lunches, and they sat together and ate lunch in a parking lot.
So I'm gonna go ask you a question here. Has anybody really come up to you and been like, hey, COVID is a hoax, it's not real, I don't need to wear masks, I don't need to do this? What has that happened?
Yes and no. Definitely on Facebook. I definitely have some Facebook friends that are definitely in the this is a hoax thing, and I've unfriended a couple of them and unfollowed a few of them just because I just can't. It's a little hard.
Say to somebody who might have that opinion and kind of be like, hey, our health is at risk, our parents, our children.
Yeah. I think the line that gets me the most is well, it's just like the flu. We should just get it and get it over with, right? And I'm kind of like that. No, because there's other viruses that are horrible. HIV is just a virus. Varicella is just a virus. herpes is just a virus, and these things, like, they have long lasting effects. So we don't know what coronavirus is going to do. So why don't we all err on the side of caution and help each other out and wear masks, because right now there are people dying and there are people that are sick. And even if you think it's a hoax, you're not going to hurt anybody by being careful, right? You might actually be helping somebody, because it's my wearing a mask or you wearing a mask is not necessarily about keeping me safe. It's about keeping, my mother safe or your grandmother safe. It's not just about us. And I think just as a society, we kind of have to get beyond that a little bit. And I remember when seatbelts, first became mandatory, it's been mandatory for a while, but people fought that too. Why do we have to wear a seatbelt? Why are there airbags in the car? It's all public safety, right? Bike helmets, same thing. It's public safety. These measures are put in to help everyone. So,
all right, thank you. Another question came in. Do you recommend any vitamins or supplements for kids in the era of the COVID-19 pandemic?
So you've got a doctor here who's not a firm believer in vitamins. I kind of feel
why is that? No.
I kind of feel like if your child is eating a well-balanced meal in this country, you are getting all the nutrients. Okay. Now, if your kid is on a complete chicken nugget and French fry diet, that is not a complete meal, right? So in those cases, if you've got a picky eater, then absolutely vitamins are perfectly fine to do. I kind of feel like, if you get all those extra vitamins, whatever you don't need, your body gets rid of anyways. You urinate it out and have funny color pee, that's my opinion. But if you do have those picky eaters, absolutely, a multivitamin is not going to hurt them at all.
Mm-hmm. Like the Flintstone ones I used to eat as a kid.
Yes. Don't eat too many of those though, because too much vitamin A is really bad for you. So.
It's good. That's kind of the scary thing. So for those of you who are just tuning in, we're with Dr. Simee Malik, who's the director of pediatrics at Salaam Clinic and is also a staff pediatrician with Lake Health for the last 20 years and an adjunct professor at Case Western Reserve University. And we've been talking about a lot of pediatric related COVID issues, pediatrics and COVID-19, how to deal with a lot of these issues. For those who tune in maybe later in this broadcast, this is recorded and it will be put up on our Facebook and social media, and you will have a chance to see it. Please send in your questions for anybody who's here. We have a little bit more time still here with us. So for those of you who are with us, please send in those questions. So Dr. Malik, thank you so much for being here with us and doing this and helping educate our community. I know you do a lot for our community. We really appreciate that. What's just some more general advice, or maybe something we haven't touched on that we could do?
Yeah. So I'm going to make a plug for self-care. Okay. Mm-hmm. And what I mean by that is this is a very stressful time for adults as well as children. Okay. Mm-hmm. So take time out for yourself as well. If you have a friend that you connect with, whatever activity brings you peace, make sure you do it. Okay. Because this is not a sprint. This is a marathon. We're in this for the long haul right now. And it's really, really important to take care of ourselves, whatever that is. Everybody's is different. And I actually have to practice this myself. I'm horrible at doing things for me. And so I have to remember to do it too, because this is taxing. It's taxing on everybody. It's stressful. We don't know what's happening. There's a lot of uncertainty. So just make sure you take time out for yourself, whatever makes you happy. I'm a reader. I read a lot. So, but what I'm reading right now is definitely not stressful. I'm reading a lot of comedy, which is weird, but just because that I can't think anymore right now. But yeah, do something, whatever makes you happy. And also, and even I've been doing this and I'm not good about this, exercise, either get outside and go for a walk, do something, because those healthy endorphins that you get from exercising are going to help your mental health too.
So we have another question coming in. And they say, sorry if this topic has been discussed, but what do you think of the schools that are opening up with social distancing protocols? is it even slightly safe to send kids back?
So, I have to tell you, some of the things that I've seen, I think these schools are really trying. I think I mean, some of the ideas that they have are really good. So, unfortunately, I kind of feel like this is really showing our society which the haves and the have-nots are really, there's a huge difference. Some school districts have a lot of resources and some do not. Okay. And I think you really kind of have to look at your school district's plans and what they're doing, versus, you know, it's very, unfortunately, it's very, very school city dependent at this point. I know of some cities that are like having little like plastic barriers that are going to be up between kids that are see-through, like almost like little cubbies, that, the children will be protected in because they can't be distanced 6 feet apart. And that's a good idea, like whether, however they're making it. I've seen like shower curtains with PVC piping and stuff, making these little cubbies for children. Because for them to sit there with their mask on for 8 to 9 hours a day, that's not really reasonable, right? So if they have these little cubbies, and they can take their mask off for a little bit, that's going to be helpful to them. Just refiguring the schools, everybody walks in one direction, so they're not passing each other in the hall. So I've seen a lot of really good things come out with these school districts, and they're really trying. So it kind of depends on whether or not you're comfortable with it. I like the whole idea of certain hand washing times, especially with the younger kids, just kind of reminding them. And then, school is going to be different. You're not going to be hanging out with your friends in the lunchroom anymore. You might be eating lunch at your own desk. There's going to be teachers moving around versus the students moving around, and that's all part of the social distancing protocol. So hopefully answered the question.
Oh yeah, definitely. Thank you. And so as a general rule for kind of parents out there and thinking about their kids going back to school, getting worried or maybe not getting worried at all, it's a hoax or whatever. But what's the general rule? Should parents want their kids in school or out of school, or is it just very nuanced that we can't really say yet?
So I'm gonna say a statement as an answer to that. Okay. Whatever choice you make is the right choice for you. Okay. And what I mean by that is so look at everything and don't second guess yourself. Okay. Because what's right for one family is not necessarily right for another family. There are many different things that go into it. Talk it over with your loved ones, talk it over with your kids too. It's amazing to me. I'll see a family of 4 children and 2 of them thrived on the online and 2 of them did horrible on it. So it may be child dependent too, so some kids are perfectly fine doing online and some kids are not. And you really honestly have to look at your own family and look at your individual situation. And then once you make it, you're making it for the right reasons, and don't second guess yourself once you make the decision.
All right, thank you so much. And thank you so much for spending the time with us this evening to go over these things for the people in the community. There's a lot of useful information, and we will definitely be having more of these sorts of webinars, and not only pediatrics but other medical sort of topics at all, anything that kind of affects the community. And of course, Dr. Simee Malik will definitely be back here with us as well. All right.
Thank you so much for having me.
Oh, of course. Is there anything else that maybe I didn't cover, or maybe wasn't asked, that you would like to convey?
Let's see. I guess I'm going to just reiterate: wash your hands and wear your mask. So
okay, wash your hands, wear your mask.
Wash your hands. 20 seconds. Happy birthday twice. So.
And before we close up, maybe you could talk about a little bit of the work you do with Salaam Clinic, and if maybe somebody out there would like to make an appointment or something.
Yeah, absolutely. So pediatrics is a little bit different because even before COVID, a lot of what I was doing was actually checkups and doing daycare forms and sports physicals and things like that. I did take a few sick visits also, but just the nature of what I do. So that obviously is very, very hard to do via telehealth. So as far as pediatrics go, just last week we had like a pediatric day at Salaam Clinic, and we're hopefully going to be doing that again. I'm hoping we'll have another one next month. But just, yeah, let me know if, or let the Mecca or Shoaib know if you need an appointment, and we'll try working you guys in, and just support us in any way that you can. We're here to help the community, and you know, all of the physicians that are involved in this, we all love what we do, and that's why we're doing it. So.
That's awesome. Thank you so much. And if
You're
you would like
welcome.
to make an appointment, you can dial 216-505-9800. You can also check us out at salamcleveland.org. You know, thank you all for coming and watching this webinar. Again, the first of many, hopefully. And again, thank you, Simee, Malik. We really appreciate it.
You're very welcome. Thank you guys so much.
All right, take care. I hope everybody has a good night.
Thank you.
Welcome.
Good night.